We all know that sleep is essential to our bodies, and a good night's rest can leave us feeling wonderfully refreshed. There is little doubt in my mind that sleep is important for our bodies. The most important benefit of sleep may be its effect on us mentally. Without it, our minds seem to suffer more than our bodies. Research has shown that a person kept up 24 hours starts suffering from fatigue, is easily distracted, and has difficulty performing simple tasks. For many people, myself included, going to bed and falling asleep is such a pleasurable experience. I don't worry about sleep. It just happens, and I wake up after 8 or 9 hours feeling great and refreshed and ready to conquer the day. However, for many of us, that is not the case. A lot of people worry that they are not getting enough sleep. Many people suffer from insomnia. They get too little or very poor quality sleep. They either have trouble falling asleep, they wake up a lot during the night and have difficulty returning to sleep, they wake up too early in the morning, or they have poor quality sleep even after 7 or 8 hours. They still feel tired and unrefreshed. According to WebMD, insomnia is not a disease and no test can diagnose it. But when you're not sleeping well, it usually has to do with some underlying cause. According to the Department of Health and Human Services, in 2007, approximately 64 million Americans were suffering from insomnia. That is a lot of people not getting a good night's rest. And it appears females are about twice as likely to suffer from insomnia than males. Now, a lot of people who suffer from insomnia complain of feeling tired, sleepy, or fatigued during the day, having difficulty concentrating and focusing, feeling depressed or irritable. Of course, not everyone needs the same hours of sleep to function well, but research does show that most people function at their best or peak level with 7 to 8 hours of sleep. The main thing is you know that you're getting enough sleep if you don't feel tired or sleepy during the day. A good night's sleep is whatever makes you feel alert, refreshed, and in good spirits the following day. The amount of hours doesn't really matter. It is how you feel that matters the most. Age is the most important aspect affecting sleep. Infants, of course, can sleep almost twice as much as adults and can sleep up to 18 hours a day. After 6 months, sleep time goes down and takes place mainly at night. By age 12, sleep patterns is almost like an adult. The next dramatic shift that we see in the sleep cycle occurs with the elderly, but what changes is the sleep pattern but not the need for sleep. For many people over the age of 60, sleep patterns may become more fragmented. They tend to wake up more at night and earlier in the morning with generally less deep sleep and more of a light sleep. Most older adults average 6.5 hours a night, and they might compensate by napping during the day. While fragmented sleep may be normal in older adults, it can also be a result of a specific sleep disorder like sleep apnea. So it is important to go see your doctor if you're not getting a good night's rest. Of course, it is not unheard of to lose some sleep the night before a major event, such as an exam, a presentation, at work, or a race. And I've lost quite a few nights of good sleep because of an exam or a race or a presentation. Now, you might worry this loss of sleep might impair your performance, but research has shown that even a night or two of poor sleep will not really impair your physical performance, but it might slightly impair some types of mental performance. However, the longer you're sleep deprived, the greater chance you're having accidents, and that is why a lot of studies, they study pilots, resident physicians, industrial workers, because a lot of times they are sleep deprived. According to WebMD, reducing sleep by as little as 1.5 hours for just one night reduces daytime alertness by about 1/3. There are 3 different levels and 2 different degrees of insomnia. Number 1 is transient insomnia, which lasts from a single night to a few weeks. It is considered short-term. It can be caused by stress, severe depression, by changes in the sleep environment, and by the timing of sleep. Number 2 is acute insomnia. That is the inability to sleep for that time period, which can be from 3 weeks to 6 months. Number 3 is chronic insomnia. It can occur at least 3 nights a week over a month or more and can last for years, and quite a few people suffer from chronic insomnia. This is considered an ongoing insomnia. Now, chronic insomnia can be primary or secondary. Primary is not related to any health problems, and secondary can be caused by medical problems such as cancer, asthma, or arthritis, can be caused by drugs, can be caused by stress, or a mental health problem such as depression, or even a poor sleep environment such as too much light or noise, or a bed partner who snores. And if you continue to suffer from chronic insomnia, you might have an underlying medical problem and would benefit from a visit to your doctor or a sleep disorder clinic. The treatment for insomnia can be actually quite simple. Often, once a problem that's causing the insomnia is taken care of, the insomnia goes away. The key is to finding out what's causing the insomnia so that it can be dealt with directly. A lot of times, making simple changes in your sleep habits can help take care of your insomnia. As for sleeping pills, they can help in some cases, but they are not a cure for insomnia. They're only a temporary form of relief. So the bottom line is that if you're not getting a good night's rest, figure out what you need to do to get that necessary sleep. It might be going to your doctor or sleep clinic or just making a few changes in your sleeping habits.